Imagine trying to spot a tiny flicker of light in a massive, dark room, a flicker that could soon become a roaring blaze. That is often the challenge public health experts face when a new disease begins to spread. How do they find these subtle early signs before they impact entire communities? It is a crucial question for keeping us all safe. Sentinel surveillance tracks diseases by establishing a network of specific, strategically chosen sites like hospitals, clinics, or laboratories that actively and continuously monitor for certain diseases or health conditions, acting as early warning posts for potential outbreaks. This focused approach provides a representative snapshot of disease activity without needing to track every single case in an entire population. The core mechanism behind its effectiveness lies in its targeted nature and the quality of data collected. Instead of casting a wide net over an entire region, which can be resource-intensive and dilute data, Sentinel surveillance concentrates resources on a limited number of sites that are highly likely to detect a disease early. These sites are carefully selected because they serve a diverse population, encounter specific at-risk groups, or have excellent laboratory diagnostic capabilities, ensuring the data they collect is reliable and indicative of broader trends. This allows public health agencies to quickly identify unusual increases in disease activity or the emergence of new strains, which might otherwise go unnoticed in a general surveillance system until it is too late. It is a highly efficient way to pick up signals of a brewing public health issue. Implementing this system involves several key steps, starting with the careful selection of these Sentinel sites. Public health officials work with local healthcare providers to choose facilities that agree to systematically collect and report data on specific diseases, such as influenza-like illnesses or antibiotic-resistant infections. Once selected, these sites then routinely submit data on confirmed cases, or even just symptoms, to a central public health authority, often on a weekly basis. This information is then analyzed to detect trends, identify clusters of illness, and compare current data against historical patterns to flag any concerning deviations. A major benefit of Sentinel surveillance is its ability to provide a cost-effective, early warning system. By focusing on a subset of data, it can rapidly detect emerging threats or changes in disease patterns, like a new influenza strain, without the prohibitive expense of a full population-wide survey. This targeted collection also enables more detailed investigation of individual cases at the Sentinel sites, providing richer data for understanding disease characteristics and severity. It is sometimes referred to as syndromic surveillance when it focuses on tracking symptoms rather than confirmed diagnoses, offering an even earlier look at potential outbreaks. Ultimately, Sentinel surveillance acts as a vital tripwire in our public health defenses. By continuously watching key points, it empowers public health authorities to detect disease outbreaks much faster than broad surveillance methods, allowing for quicker interventions like vaccine campaigns or public health advisories. This early detection capability saves lives and significantly reduces the overall impact of infectious diseases on communities around the world.
If you're into this, like, subscribe, and drop a comment.